That is, I mean, that's ultimately what we're looking at here. It's these lower cost platforms. Certainly he's not a Continua member yet. We'd like to have him join the alliance, be able to capture that data. But I think that it is that point. It is that those innovative aspects of driving those costs down and making complete systems that can capture this data and flow it across systems effectively. Yes, right here.
There's a chicken and egg problem here. In order to make cell phones, you look at movies from the 80s, you remember those big honking things that people used to carry around, and look at where cell phones are today, right? The innovation cycle has fed off the consumer in terms of the volumes, people buying and replacing cell phones, technology companies investing in getting a return on investment quickly. You don't see that happening with for example, take for example medication monitoring systems for the elderly, right? We've had that for 10 years now, different kinds, and they're still pretty clumsy, huge, all kinds of problems. But I'm completely convinced that you will have that level of innovation. Once we get on that path, there will be companies that can bring solutions to the market. My own team, the kind of stuff that we have developed is just Star Trek stuff, but we can't bring it to the market, can't invest further in all the things required because we don't see a market.
A lot of it is its business model. There's one company we're working with in San Diego called the Pill Phone. They have a medication reminder system that brings up the actual picture of the pill. It's a closed-loop system. The question now is business model. And luckily in this world, it's all a win-win-win in the sense that if you can provide systems for the patient and they are more compliant, they're better, they don't go back to the doctor, and people sell more supplements. So this is all happening in real time where we're trying to put this Rubik's Cube in place so that there's enough incentive through the parties. But that's an example of just an application. And someone said making the technology easy. A lot of it's software now. It's how do we build these systems on top of the devices, and what are the optimal devices that we need to put together.
Return of investment, I think, is a very important thing. We should not just dismiss. Deepak, you mentioned it. The normal expectation in a business is having return of investment somewhere between 3 and 5, 6 years. In the medical industry, especially what we talk about, and there's a study that just came out from the European Commission. EHRs, you probably see a return after 10, 12 years. And this is one of the issues. How do you attract the business to invest in such a long-term proposition? And as we said, there's a lot of complexity that is unique to the health industry, that's unique to health informatics, that is not the case in other industries, because in other industries you can pretty much isolate a problem. Here you cannot. Diseases are intertwined. You have comorbidities you have to deal with. I think all this compounds the effect that it is complex. The technical solutions in a narrow sense, they are simple. But in a broader sense, to really do disease management, it's very complex.
Yeah.
Yeah, you're okay. I'm done.
Sorry. Yeah. I personally don't think it's about the technology or the device. I don't. And I guess it's possible to try to chase the holy grail of personal health devices. But in the absence of examples of people you know or trust who have them and find them actually helpful and maybe cool, an environment that makes it easy for individuals to get value out of them, it's really not about the gizmo. If you think about it, the consumer electronics devices that look so cool in this show only got here because several generations ago, they really weren't that good, but they fulfilled a basic need, right? And so it's really not about the technology. It's about these other factors that really need to come into place.
I just want to add one thing. When I sounded a little bit negative, actually positive effect is the little things are happening. Continuous one example. Little things happening. We should let them happen also. So have to support them. And then you build, that's how you build systems. Okay, one piece at a time. That's what we're doing.
That's a question right down here.
Absolutely.
So a couple things about that. That is a great example that demonstrates the challenge of the extraordinary promise of this industry. The first is if you think about many of the individuals who will be helped by these technologies, if you think about the use cases that Continua is focused on, would not be Medicare recipients. They wouldn't be, number one. Number two, one of the few things that appears to be clear in the analyses of the current legislation is home care is looking like it's going to be cut. It's one of the losers, right? And so it's something that many people say there are good studies that show it's efficacious and great stories about it, but in the overall scheme of regulation and reimbursement, it's looking like it's not going to, it's not going to benefit from the health reform and the financing reform. It's sad.
Yes, one last question here. I'm sorry. And from a Continua perspective, like I said, as I mentioned earlier, yes, we feel that the consumer aspect of this, when we have to look at this, we look at this as there's four different models for which affect our particular areas, and that is there's directly the companies who are the consumer themselves. There's the individual consumer. There's the provider organization. So as we look at the new activities, we just heard from one from here around using home health care, but there's new models called accountable care organizations. Bundling of payment is also going to be another opportunity for us when we take a look at bundled payment opportunities with healthcare institutions. And then the medical home activities we see as another driving factor. In addition to that, if you take a look at what was already passed within the high tech, in the years 2013 and 2015, there are provisions for physicians to get additional rewards if they're using remote monitoring technologies. So there are little bits and pieces all over the place in some of this activity of where some of the federal governments are paying for this activity. There's the commercial payers. The commercial payers will need to log on and use these types of systems. They are significantly seeing that they need to manage these hypertensive patients. They're seeing a significant rise in weight of their in younger ages and populations that they need to manage these disease states from that perspective as well. So we see the commercial insurers taking an interest in these health and wellness programs. And then directly we also see our employers themselves because they look at this as a productivity effort. That absenteeism and presenteeism, where you have employees who aren't healthy enough necessarily